Hello and welcome back to a complete denture journey. This is video 2 of the instructional set for New York City College of Technology, Department of Restorative Dentistry. Video 2 is pouring preliminary alginate impressions. This is a laboratory instructional video. Once again, I am Oscar Galvis. Let's begin. This video begins where video 1 left off. The clinician or dentist has taken preliminary alginate impressions and has sent them to the dental laboratory. It is now the dental technician's job to receive those impressions. The first thing a dental technician should do is disinfect the impressions. In doing so, they should follow the manufacturer's instructions depending on the manufacturer and type of impression material. While doing this, it's always a good idea to wear the personal protective equipment necessary, such as gloves, masks, and goggles. Laboratory tip is to rinse off the disinfectant after proper application to prevent any stone breakdown that may occur if the stone is directly poured onto the disinfectant surfaces of the alginate impressions. The application of debubbleizer is important. Debubbleizer is a soapy agent that reduces the surface tension. In other words, it aids in the flowing of the stone to capture all the anatomical structures necessary to fabricate the next appliance. Next, we're going to mix our gypsum. Now, technically, in the textbook, Air Force Manual states that powder should be added to water. The reason why this is to reduce entrapment of air, which causes bubbles and voids in the model work. However, it is common within laboratories to add water to stone in that you're able to control the consistency of the stone a little better. Some things to note when mixing gypsum. When using hot water, the setting time will decrease. When using less water, the setting time will decrease as well. The more water, the longer the time it takes to set, and the colder the water, the longer it takes to set. Looking for the proper consistency, you should be able to turn the bowl upside down and stone should not fall out. Once the proper consistency of the stone has been reached, we can then begin pouring our impressions. You want to flow stone from one portion of the impression and watch it flow very easily to the other side. As the stone flows, you want to be able to watch the stone capture all the necessary anatomical structures. This is facilitated with the use of a stone vibrator. This aids in the reduction of surface tension along with the debubbleizer that was used previously. The same techniques can be used with both a maxillary and mandibular impression. It should be noted that what we are creating here is a preliminary stone cast. On these preliminary stone casts, we will fabricate a custom tray. A custom tray is a tray that is customly fit to a patient's mouth. This tray will then facilitate the ability to capture a detailed impression good enough to fabricate a complete denture on. For now, the preliminary models can be poured freehand and a base can be created using the stone. Once a custom tray impression is returned to us, we will then use a technique called beading, boxing, and pouring. We will talk more about this technique at a later time. Another laboratory tip is the proper stone disposal. Dispose of any large excess of stone in the garbage, not the sink. It will expand the life of the plaster trap. Once the stone has a thicker viscosity, you can then flip the model and create a base. If this is performed too early, the stone will run and the model will not have a base. Once the setting time has been reached, we can use a tool to carefully pry the impression from the model at the borders of the impression. It is common for dental technicians to use lab stone to pour their complete denture preliminary models. Once the models have been retrieved from their impressions, you can use a model trimmer to reduce the bulk and create a smooth model base. This is usually done with a wet model trimmer. Another laboratory tip is, should you wear gloves? Wearing gloves while trimming may actually be dangerous. gloves can get caught on the cutting disc. Sometimes we must evaluate the situation to deem whether wearing gloves is more dangerous than using without. When performing the model trimming, trim the model uniformly, creating a land area while not removing any anatomical landmarks necessary to create the next step, which is a custom tray.